Let's bring him in, Dr. Joe Congeni, Akron Children's Hospital Sports Medicine Center. And Joe, where do you want to start this week?
Hey, Ray. Everybody's still talking about some of the oddities related to the championship football game on Sunday. Sometimes with sports, really strange things happen, and sports medicine seems to play a role in it too. So, kind of going back over it, everybody was interested in the championship game, in this Mr. Irrelevant at quarterback who had taken his team and looked very good, had taken his team to the brink of the Super Bowl. His name's Brock Purdy. He was the last person drafted last year. Unbelievable. The person they call Mr. Irrelevant, and was playing very well. And for people watching the game, the classic mechanism of tearing the ligament in the elbow in football is what happened with Brock Purdy. When quarterbacks are cocking their arm to throw the ball, particularly throw a long pass, and they get hit and the elbow gets pulled in the opposite direction of how they're trying to come through and throw the ball, usually stretches that ligament on the inside of the elbow, and we get some degree of tearing or spraining of that ligament. Grade 1 is a stretch, and you see quarterbacks kind of walk it off and sometimes stay in the game. Grade 2 is a partial tear, and they may go over to the sidelines and get taped and try to get ready to come back. Grade 3 is a complete tear or rupture. They tear that ligament called the ulnar collateral ligament. Yes, the same ligament that pitchers tear, but a totally different mechanism. They tear that ligament, and watching him on the sidelines, they were trying all kinds of things over there with him, taping him and throwing, and they had him in the tent, and they were trying to massage it and everything else. He just did not have any strength at all, and retrospectively this week, we did hear that he ruptured it. He had a grade 3. He tore that ligament completely, so he could not throw the football. You can't generate any force at all when you don't have that ligament on the inside of the elbow to throw a ball. So they went to who was their fourth-string quarterback, actually their second string for the game, Josh Johnson, and early in the third quarter, he gets hurt. So now there's no quarterback at all. So one of the biggest weekends in the NFL, they don't like it this way. It basically became game over. They could not throw the football, and there's no way to come from behind or win a game when you can't throw the football at all. A lot of people talking about, hey, Christian McCaffrey should have gone in, or the local kid, Kyle Juszczyk, the fullback, could he have gone in and played some quarterback? No, at that level, you just can't do that. Maybe at a high school level or something, but he just couldn't play. And there is a rule that a lot of people are talking about this week, an old rule called the third quarterback rule. And it came out in the 1990s, and what would happen is that they could carry an extra quarterback and dress that quarterback, and if the first two quarterbacks got hurt, the third quarterback could go in the game, but then the first and second quarterback could not go back in the game, and it was called the third quarterback rule. And it was abolished in the year 2011 because they went from 45 players dressing to 46 players. They took that rule out. But there's never been a situation where it's been such an important impact that played on a game, and a huge game with everybody watching. It became kind of just an hour and a half of just watching a game that you knew the outcome, and the NFL doesn't like that very well. So there is a lot of talk this week about bringing back a third quarterback rule, and so that's some of what's being discussed, is a way to have a third quarterback healthy who could play. The other big issue that everybody's talking about is how will they fix Brock Purdy's elbow? Is the traditional one for pitchers is called Tommy John surgery, but it's a very long recovery. You know that from our discussions in baseball, and it's over a year. People talk about 18 months or so with a full reconstructive Tommy John surgery. There's a newer surgery that we're using in younger kids that's called a direct repair that's maybe half that time or less time before you get back, and that for sports like football may be a good enough repair to give them good support. So the big interesting thing will be, when does Brock Purdy have surgery? What kind of surgery does he have? And does he just go down as a strange football footnote? Sports footnote is that this Mr. Irrelevant jumped in, almost brought his team to the brink of the Super Bowl, and maybe he never plays again because he really was third string behind two other quarterbacks, Trey Lance than Jimmy Garoppolo, maybe he never gets his chance again. So strange things happen with injuries, and this one was a really strange one with both quarterbacks going down, and this being a complete tear where he could not throw the ball at all. He threw two more passes, a 3-yard pass and a 5-yard pass.
You know, Joe, speaking of quarterbacks and coming back, it was just announced about 2 minutes ago, Tom Brady has officially announced his retirement, and he says this is for good. He is done in the NFL. So there's a quarterback we will not see behind center starting next year.
That's a quarterback that hung around a long time. With all these injured quarterbacks that we see, Ray, isn't it amazing that he kept himself so healthy? He had a few injuries throughout his career, but oh my gosh, I just saw the same thing you did. We must be on the same site here. Just came out. I think that they say 43 years of age, Ray?
Yeah. Tom Brady officially retiring, and he was a guy that was so smart in the pocket, right, Joe, that he got rid of the ball quickly, and I think that's how he was able to avoid a lot of those injuries, as he was just like a doctor back there in the pocket taking care of the position. Hey, Joe, good stuff this morning. Always appreciate the time. Welcome back, my friend, and we'll get together again next Wednesday.
We'll talk next week. Thanks, Ray. Have a good